infective endocarditis is always being missed. The diagnosis won't come in the minds of the clinicians in peripheral clinics, in peripheral OPDs and in rural areas. So how can you diagnose the infective endocarditis? There is a criteria called as modified Duke's criteria. And in that criteria, there is a definitive diagnosis of infective endocarditis with a pathological criteria. Either you demonstrate an active endocarditis through histopathology of a cardiac lesion, that is vegetation or abscess, or you detect the organism, the microorganism, from the abscess through a culture or serology. Then comes the major criteria and minor criteria. The major criteria, the first one is the demonstration of the organism through a blood culture. That is, the two separate blood cultures should be positive, which are consistent with the infective endocarditis, that is Streptococcus viridans, Staphylococcus aureus, then Hayes-Sack organisms, etc. Or a single blood culture being positive for Coxiella burnetii, or the serology, that is the antibody against it, should be positive with a much higher titer. In the second major criteria, you use the echo to demonstrate endocardial activity, that is, you see an abscess, there is a new partial dehiscence of the prosthetic valve, or you demonstrate an oscillatory intracardial mass. Then comes the minor criteria. There are 5 minor criteria. First one is there is a predisposing risk factor, like the patient is a drug abuser, or there is a history of IV drug abuse, or there is a pre-existing heart disease, a cardiac lesion like valvular heart disease, or there is a prosthetic valve. Second criteria is the fever, which is more than or equal to 38 degrees Celsius or 100.4 degree Fahrenheit. Third criteria is the vascular phenomenon like Janeway lesions, intracranial hemorrhages, major arterial emboli, aneurysms, conjunctival hemorrhages, etc. Fourth one is immunological phenomenon, example glomerulonephritis, Osler nodes, Roth spots, etc. And fifth one is the microbiological evidence, that is the blood culture which is not meeting the major criteria, or there is a serological evidence demonstrating an active infection in the body with an organism which is consistent for infective endocarditis. So to diagnose the infective endocarditis with these criteria, there should be 2 major criteria, or 1 major criteria with 3 minor criteria, or 5 minor criteria should be satisfied to diagnose the infective endocarditis.